Today I'll explain to you about the HCG diet. HCG diet. So it's a diet program which is for 40 days. Okay. So for 40 days, that is 5 weeks approximately, a person would be on a very low calorie diet and take HCG hormone externally. Together this program will work in such a way that you will lose about 8 to 10 kilos in a matter of 40 days. Okay. We'll talk about how this works, what is the principle behind it. HCG is a hormone which is classified as gonadotrophins in the body, and you don't have to worry about hormone because hormones are produced in your own body, and similarly this HCG is also produced in your own body. In a male it is produced from the testes for sperm maturation, in a female it is produced from the ovaries for egg maturation. That is why it is there in nature. Okay? But when the woman becomes pregnant, she will produce more HCG, that's why it's also called as the pregnancy hormone. Okay? So during pregnancy, from day 1 to the 9th month till the baby is removed, the cord, the baby and the mother cord which is connecting, which is also called as the placenta, that will produce tremendous amounts of HCG, about 50-60,000 units per day. Okay, so in pregnancy, the mother, there is a specific role. It is a gonadotrophin, meaning it is related to the development of the baby's sexual organs. Okay, apart from it, it also has a secondary metabolic role. That metabolic role is related to the hormone making the mother utilize her fat for the nutrition of the baby. Okay, this metabolic physiological role of the hormone is what we take for the diet principle. Okay. So supposing a person is eating around 2000 calories and we are giving them a 500 or a 700 calorie, which is a very low calorie diet, there is a deficit which is significant. It's created in the body, meaning you are almost having around 1000 calories deficit per day. So if you create that deficit for 40 days, and obviously you are not producing 50,000 or 60,000 units of HCG, so we are giving you 125 units of HCG from outside, either in the form of a subcutaneous injection or in the form of a cream. Okay, so when you take that externally and you follow a low calorie diet, the HCG is making you use your already stored fat for the purpose of that 1000 calories which deficit which you have created. This 1000 calories, because of the HCG, it will come from your fat. Usually when somebody does a low calorie diet, there is a lot of muscle loss, they become fatigued, and you cannot do it for 40 days. There is no way you can do it for 40 days. Here your body's metabolism is stabilized because your body is not recognizing that it is getting less. You are getting about 500, 700 from an external source, and you are getting about 1000 from the internal source. So technically your body's calorific demand is fulfilled. Okay, so you are not going to have the fatigue, the tiredness, the depression associated with low calorie diets and things like that. If you look at the whole thing, HCG is not magic. You need to create that demand. HCG is going to make you lose the fat. So let us say somebody is taking only 125 units of HCG every day. They are not going to lose any weight because it's not the property of the hormone at all. HCG is therefore not FDA approved for weight loss. Why it is not FDA approved? Not because of any safety issues, because it is not the property of HCG to make you lose weight. When you are doing a low calorie diet and a low dose of HCG, it is going to make you lose weight. Okay. So the HCG hormone, if you see that the purpose is very clear. Is it safe for everybody is the most important question one needs to answer, but it is not safe for everybody because the low calorie diets cannot be done by everybody and anybody. I'll tell you some criteria which we don't, we use it as an exclusion criteria, meaning obviously you cannot do it on people who have uncontrolled diabetes. For them the 500, 700 calories are not going to work. Cannot do it on people who have acute heart disease or uncontrolled hypertension. It cannot be done on people who have liver failure either because of alcoholism or hepatitis or cirrhosis. They are not going to metabolize the fat anyway. Cannot be done on people who already have psychiatric problems, and even for people who have epilepsy. So these are the conditions in which we do not do the HCG program, because the low calorie diets in a person who has that kind of a medical problem, it may not be a safe proposition to do a 500, 700 calorie diet for that. For other people who are otherwise normal and who don't have any major medical or health issues, this is a very safe program because it's only for 40 days. And the diet usually consists of a very high protein and low carb diet, which is anyway healthy for the body. Either way, whichever way we do it, we always take the medical test first. Even if a person doesn't have any medical histories or any particular complaints, we go through the master health checkups to check the liver function, kidney function and everything. And then only we also look for specific mineral deficiencies or vitamin deficiencies and all that. So what happens is we specifically supplement all that. Somebody has iron deficiency, we do give them iron supplements and things like that, so that all the nutritional deficiencies are taken care of and they don't get complicated with the diet. The diet itself contains a lot of protein, so there is no hair loss or any skin problem or anything of that, which usually happens with low calorie diets. And also when the person is out of the program, for example, if they lose 8 to 10 kilos, which is an average in this particular diet program, it's very important for the patient to understand that they have to do the diet, otherwise HCG is not magic. After that, we wean them off. From 500, they come back to their original diets of 1500 or even 2000 depending on their physical activity in a matter of 1 month. And we do the post diet follow-ups for a minimum of 3 months, so that they comfortably come back to their normal lifestyles and normal food, yet be able to maintain the weight loss. So the weight loss is very easily maintainable here, because whatever the person is losing in terms of weight is fat. And that is not by magic, it is because of the HCG hormone itself. That's the property of the hormone. In women particularly, we do not do it on women who have history of ovarian cancer, meaning in their families, the mother or the aunt or any of that sort. If they have a history of ovarian cancer, we do not do this program at all, because the HCG is produced by the ovary and we do not want to take any risk. The HCG kit that we use comes from the US. It's repacked in Bombay and sent to us. This particular dosage is not available so freely in our country because it's not manufactured in that particular dose. So we ensure, first of all, we go through all the medical histories, family histories, and even their behavioral and psychological histories, because if we understand that this person will not do the diet because of some other emotional and behavioral problems, then obviously we are not going to give that particular program to that person. So it is important to understand whether a person is capable to do the diet or not. So that is the most important thing. So for us in our clinic, we basically go through the entire protocol very meticulously, so that, and we do not sell any HCG over the counter. We ensure that the patient is, the program is safe for them both medically and otherwise, therefore our results are extremely good. So HCG, I would say again that if it is done well in the right person, in the right manner, it is a tremendous tool. It's not a program which is suitable for everybody and anybody. We ensure that particular safety.